might a cat show pain? What would you think would be symptoms of a cat being in pain? What would you think he would see?
Sits.
He just sits. That's a really good one. He just sits. I'm going to have you pass that around. What else might you think? Does it move well and hides? That's a big one. They just don't want to do anything, and they don't want you to bother them. Purring. Sometimes you'll see that. They'll purr because they're stressed. They maybe even don't want you to touch them, so they'll start purring. Especially the cat. Change in litter behavior. Absolutely. Change in litter behavior. You might see that. See how subtle? It's not. Occasionally you'll see vocalization, but it's not usually that. I mean, when my hip was hurt, when I stepped on it, there were times I'd go, ow, and then look at me and like, oh, what's going on? But a cat rarely does that. And so you really have to look at the subtle changes like you're talking about. What else might you see as pain symptoms in cats? Panting, absolutely. We can see cats pant. And sometimes they come into my office and they're scared and they pant. But when I see a panting cat in my office, I'm looking for pain. Because a cat won't normally just pant. Won't pant. What else might you see? Dilated eyes. Absolutely. You see those eyes being large, the pupils being large. And that's something that you might pick up. Some of the things are vocalization. Occasionally you see this, but not very often. That's a rare occurrence. The purring, the hissing, the growling. Changes in daily habits. You see this happening to your cat, you better take it into your veterinarian. Unless you've trained him to do that. And I guess that's part of the point. You need to know what's normal in your cat. You do know what's normal in a cat. You need to look for those subtle changes because that's what they're telling you there. Decreased appetite, decreased urine, won't groom. Oh my goodness, how many 18-year-olds do I have come in that have mats all over the place where they used to be silky and shiny, and now they aren't because they can't get back there. They can't get back there and groom. Self-mutilation. That cat is licking that area because something underlying hurts. So if you see that kind of thing, that indicates pain underneath. Activity levels you mentioned, hiding, restless. Not some of them just. One of the real subtle ones is, how your cat will curl up and sleep for 12 hours. But if that's normal for them in the nice sun and they're wonderful, that's great. But if you're used to seeing that and you find they only can sleep for 2 hours and then they have to move positions because it's getting achy to be in that position, then that's a sign. Posture. A cat that's comfortable either rolls up nice and comfortably or they have their feet up. And a cat that hurts is abundant. And of course the arched back, that isn't normal in a cat. I mean, momentarily it is, but it's not normal as a way to be standing all the time. Facial expressions, you mentioned this, the dilated eyes, ears that are not pricked up, they're kind of out like a flying nun. Unless you have a breed that does that, sorry. Self-protection, this actually happens to be a cat like right there. Another cat, they had a little tussle and they got the infection in there, and that for hers. That one's pretty obvious, and you would be taking them in for help with that one, but that's certainly one of the ones. And here's an interesting one. A cat who's never been aggressive when you've been petting them, and all of a sudden doesn't really want you to pet him. Or used to love to get through him, and now doesn't want you to put a brush across that back because it hurts. Real subtle kind of things that you have to look for in a cat. What do you do with pain? At this point in our lives, there are about 4 things that we can do. Weight loss is a biggie because if you've got some pain and you have to carry more weight around with it, it takes more to do that. But we also know that fat cells are not benign. They're releasing things that protect themselves. So they're going to release pheromones and hormones that make your cat not want to move around because they don't want you to burn off. They don't want to be burned off. They want to stay there. So they have some active things, and they do release inflammatory enzymes. So you get fat cats, and they're releasing things that make them more prone to inflammation. And the more we understand inflammation as we're learning and as we're going along in this wonderful journey of finding out about cats, we understand that chronic inflammation is a detriment to all mammals' bodies. That it creates processes that make you more prone to disease. And so these guys, you know, you've got fat cat, oh, nothing, no, big deal, big deal. Get that weight off. Physical assistance. You know, your cat may not be able to get up the perch anymore, but that's where they want to be. Build them a little step-by-step up to there, or a little set of steps to go up onto the, you know, the couch beside you, or up on the bed. They obviously love to be up, so you're going to need to help them. And just putting them up doesn't really do it because they have to get down. So, I mean, certainly you can put them up and put them down, but you need to look at their environment to make it so that they can get to the places they need to get. The new heated nets are wonderful. And if you can get yourself a deal on them, you know, on Amazon or something like that, they are really, really nice for these older cats, just to have some heat on those sore places. The litter boxes that are cut down in front.
Yes, you do.
Okay. Weight boxes, okay. The litter boxes that are cut down, so it's a little easier for them to get in and out. Because a lot of these cats you'll find they have a bowel movement or urine right here because it just hurts to get up over the side and back down the other side. So physical assistance really can help that way.